The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. That was John Denver, and most of what we will hear today will be from John Denver, and I'm John Minarsik. And today is December 16th. It's a Thursday. It's the last webinar of the week, and it's the first webinar of our new system. It's 9 o'clock in the morning. This is our 22nd webinar. And today we start out what we call the block or the system respiratory. We just spent 5 webinars talking about cardiovascular. So now we're on to a new topic, and that's respiratory. And the first webinar out of 4 will be upper respiratory, or what they generally call ENT, everything above the lung that's in any way part of the respiratory system, including oral cavity, so it does overlap a little bit with GI perhaps. And then the next 3 after that will be mostly on pulmonary diseases. And probably the third one we may cut a little bit short to do a lab. We have not had a histopathology lab. So we're going to have a lot of fun in this block. I like it a lot. I've always liked it a lot. We'll do 4 of them. Today's the first one. We'll do 2 of them more next week. And then Tuesday after that, the lab and the finishing. What more can I say? Let me tell you about the personality of this particular webinar today, because I've given it several times. I guess we could call it ENT. It's very pictorial. It's very graphic, just like the ENT doctors are. I don't know if you've known any ENT doctors, but they don't want equations and physiologic charts and everything. They want to see stuff and they want to do stuff. So today we will be seeing a lot of diseases. We'll be speaking briefly about each one. And I can tell you, I think we're probably going to be having fun too. So we might as well start the fun and close off this ugly guy over here and get into a little bit of what we're going to be doing. ENT, ear, nose, and throat, otolaryngology, upper respiratory system, call it what you want. We're going to include the oral cavity. So this is a nice way to start it by delineating the various types of pharynges, the nasopharynx, the oropharynx, and the laryngopharynx. So what is our objective for today? Okay, well, our objective, like we have always had, will be to discuss the degenerative, inflammatory, and neoplastic diseases of that particular region of the body. Okay, now when we talk about the diseases, some of which will be very brief and it'll be very, very pictorial, very graphic. I don't know if you saw me flash the PowerPoints at the beginning. If we can, we'll talk about the etiology, pathogenesis, morphology, and clinical manifestations. Now remember, you need all 4 of those to have something called a real disease. Otherwise, you could probably think that the crap that the advertisers and drug companies throw at you are real diseases, okay? This is a good place to start rather than a chart, but with a real anatomic exhibit. This is a midline sagittal section through a head and neck, okay? Now, a good general principle, okay, is that when you have these various cavities, oral cavity, the pharynges, nasal cavity, nasal sinuses, so forth, if they do not generally touch solid things like food, then they're probably lined only by a single columnar epithelium, perhaps mucus as well. Okay, if they do touch food, then they are generally squamous. That's a good general principle, but remember, whenever a columnar area is subject to inflammation or other types of general trauma or wear and tear, normally or abnormally, it turns into squamous. So we have to also consider the concept of squamous metaplasia. This general region includes the oral cavity, the so-called upper respiratory tract, everything above the trachea, okay, the ears, outer ear, middle ear, inner ear, the nose, and the paranasal sinuses and the nasal cavity, and of course the salivary glands, both the three classic salivary glands, as well as a whole wide variety of small accessory salivary glands in the lip and other parts of the oral cavity. What is the pharynx? That seems to be sort of a big, complex question, but it's very, very simple. The pharynx is divided into three parts, and basically it's the air spaces posterior to the oral cavity, sort of, okay? Now, if you take the uvula, the tip of the uvula, the soft palate, and take it all the way to the top of the nasopharynx, that region is defined as nasopharynx, and basically the separation between it and the oral cavity is the soft palate, of which the uvula is the very posterior inferior tip. Now, between the uvula tip and the epiglottis is a relatively short space, probably less than an inch approximately, and that open space posterior to that is the oropharynx. So the oropharynx is the smallest of the three pharyngeal cavities, and then everything inferior to the epiglottis until you get to the trachea is called the larynx, and that's the entire upper respiratory system, which we'll be talking about today. A lot of which will just be simple, interesting, curious pictures, which I'm going to be showing you, and not talking about them in depth. I'm glad I'm not talking about them in depth because I don't want you to run away right now, but there's going to be about 79 PowerPoints today, which we're going to generally go through pretty quickly. So there's the oral cavity. Some of the issues we'll be talking about be teeth, gingiva, the bone that is connected to the teeth, alveolar bone, the jaw and maxilla. We'll talk about inflammatory lesions and so-called reactive lesions, okay, which are basically adaptive type things like fibrosis or hyperkeratosis. Infections, the common infections, herpes, other viruses, fungi, of which of course Candida albicans is the main one. We'll talk about an interesting condition called leukoplakia, and don't let that fool you, because leuko means white and plakia means plaque. So that's all that it is. Certain type of leukoplakia, though, which has a jagged edge called hairy leukoplakia, is something the dentists usually freak out over because that's very, very common with AIDS. We'll be talking about both the benign and the malignant squamous tumors, the papillomas, the polyps, the carcinomas, squamous carcinomas, of course, and a few little cysts and tumors which arise from the same epithelium that gives rise to tooth structures, or odontogenic cysts and tumors, okay? In the upper airways, we'll be talking about the nose itself, inflammations, common tumors, and tumor-like conditions. Same thing with the nasopharynx, and pretty much the same thing because that cavity leads into the paranasal sinuses. And technically, now the larynx, the open space inferior to the epiglottis, we'll talk about common types of inflammation, laryngitis, as well as tumors, and you could guess that those might be squamous carcinomas if they arise from squamous epithelium or squamous metaplastic epithelium. Ears are very easy. We'll talk about conduction hearing loss, common. I probably have a little bit of myself called otosclerosis. It's a degenerative lesion. In fact, it's very similar, if not identical, to degenerative arthritis in a way. It's common inflammations, otitis externa, otitis media, and neoplasms, if you could imagine that there might be some other than what arises from the epithelium. In the neck, a couple of interesting conditions, remnants of embryologic structures called bronchial cleft cysts, not too uncommon and not really extremely dangerous, but they have a very classic appearance and anatomic location. The remnant of the duct that connects the tongue to the thyroid gland. You might remember that from embryology. It's called the thyroglossil duct. Sometimes it could persist and not close off and actually form a little cyst. Sometimes you can see thyroid follicles within the cyst. And a tumor has about 10 different names. We'll call it a paraganglioma, and it's a mass of cells that basically proliferate from the carotid body. You might remember what that does, don't you? It has a lot to do with recognition of pH, oxygen, CO2 levels. Finally, the last topic for today will be salivary glands. If they degenerate, which means they don't work slow, you might have a dry mouth, xerostomia, inflammation of the salivary glands. You may have had an inflammation of your salivary gland, parotid gland, when you were a kid, if you had mumps and you're old enough to be close to my age, which you're probably not. And finally, the two most common benign, true neoplasms of the salivary glands, and the most common 2 or 3 malignant neoplasms of the salivary glands, whether they're your primary glands or your accessory